Hi everyone, my name is Clint Neal, and today I'll be talking about fetal alcohol syndrome, as well as a few other areas that will be important and are associated with this syndrome. What is fetal alcohol syndrome? Fetal alcohol syndrome occurs when the fetus is exposed to alcohol during the mother's pregnancy and causes a variety of abnormalities, ranging from brain damage to organ irregularities, and other things we'll go in more depth into later on. The alcohol passes through the mother's bloodstream and through the umbilical cord to the unborn child. While there is no cure to fetal alcohol syndrome, we can help make everyday life easier for the individual, such as an intervention specialist that will help the individual with academic and social needs, therapy ranging from speech therapy, occupational therapy to help the individual complete everyday activities with ease, and physical therapy helping improve the motor skills of the individual. Counseling can be used to help improve behavioral problems. There is no medication for fetal alcohol syndrome. However, it may be prescribed for co-occurring problems such as depression or anxiety. However, healthy alternatives can be used to help with ADHD, depression, and anxiety, such as yoga, art, and other relaxation techniques. Facts and statistics. Fetal alcohol spectrum disorders is one of the most common intellectual disorders next to autism. In 2014, there were 40,000 new cases estimated of fetal alcohol syndrome and nearly 60,000 new cases of autism. 10% of women have reported drinking during the pregnancy. While there is no cure to fetal alcohol syndrome, however, it can be prevented by avoiding drinking during pregnancy and even breastfeeding. If an individual has fetal alcohol syndrome, he or she has a 94% increased risk of having a co-occurring disability. There are over 400 conditions that are linked to this. Some of the most common conditions of this are autism, ADHD, bipolar disorder, and major depressive order. There's a price tag of $2 million throughout the lifetime of this individual. We will take some time momentarily to answer these questions. True or false, there is no safe amount of alcohol to drink during pregnancy. There is no test to diagnose fetal alcohol syndrome. Of all substances, alcohol has the most damaging neurobehavioral effects to the fetus. Fetal alcohol syndrome is 100% preventable. Below I have the links for you to find the following questions. Please pause the video and answer these for me. What's affected physically? Individuals suffer from organ defects, most commonly the heart, kidneys, and brain, as you can see in the photo. Individuals tend to have smaller features and slow growth, smaller height and weight, and a smaller head size with slanted droopy eyelids. Individuals may also suffer from deformalities of the joints, limbs, and extremities, vision and hearing impairment. Due to the brain irregularities, individuals suffering from fetal alcohol syndrome have poor fine and gross motor skills, as well as balance and coordination. As we just discussed the physical effects of fetal alcohol syndrome, we'll move on to cognitively. Cognitively, individuals with fetal alcohol syndrome have trouble communicating and typically have poor judgment that comes along with a lack of fear. The individual typically has a difficulty in the classroom, especially in math class and things involving memory. He or she will need assistance to function throughout the school day. One of the biggest areas impacted by fetal alcohol syndrome is the child's behavior. An individual tends to lose focus on the task at hand and may need to be refocused in the classroom. He or she may have problems interacting with others and doesn't really understand others' boundaries, such as personal space, and can sometimes go off on tangents, talking or even come out with inappropriate comments. The individual is also led easily by others and gives in to peer pressure. And then controlling his or her emotions and thoughts are a big obstacle for them. If someone suffering from fetal alcohol syndrome, they may become easily upset and need a place to de-escalate. Here are some things to consider when working with a child with fetal alcohol syndrome during physical activity or even within the classroom. Visual cues and aids will help the individual with learning and understanding the activity at hand. They're able to process the information a little better so they can grasp the core concepts of it. Also, with the transition time, we need to give them an ample amount of time to go from one activity to another, or even when the class is ending, we can give them a heads up so they're able to transition smoothly. Then also to practice any new activities or skills they're learning so they can once again grasp the core concept of that and apply it. Then also, they have difficulty controlling the emotions, so we need to be ready for that. And some days they might be feeling better than others, and some days things might set them off that didn't set them off the day before. And then also eliminate distractions in the classroom or during the activity will allow them to focus on the task at hand. One of the co-occurring conditions linked with fetal alcohol syndrome is major depressive disorder, which is a constant sense of despair. It makes it difficult to function with everyday activities. Major depressive disorder is a very common disorder, usually brought on by life events or other mental disabilities. With women, they're more than likely to suffer from depression than men. However, with that being said, men typically don't report being depressed. Those with depression are 4 times as likely to develop a heart attack than those who don't suffer, which is also important to know when working with fetal alcohol syndrome, since typically they already have heart irregularities. Then also, major depressive disorder is the leading cause of disability within the United States. And one of the things to remember is to always seek help. Depression is the cause of 2/3 of the reported suicides each year. As I had stated earlier, in 2014 there were 40,000 new cases estimated of fetal alcohol syndrome and nearly 60,000 new cases of autism. With autism, it shares similarities to fetal alcohol syndrome and is recognized by the DSM-4 as a mental disorder where fetal alcohol syndrome is not. 1 in 68 children have autism, and 1/3 of those with autism are nonverbal. However, those with autism do have strengths which include above average intelligence and also a good memory, excelling in many other areas. However, they still have social and communication difficulties, and diagnosis of autism usually occurs in the first 2 years of their life. It's time for our last quiz. All the answers we covered in today's lesson. Once again, thank you for your time, and please pause the video and answer these questions.